All right, good evening, everyone. This is Dr. Schilling with Secoya Health, bringing this week's Wednesday Wellness Minutes. And we have a lovely guest here. Tambra's joining us this evening. And we're going to talk about pins and needles. And before I allude too much, I'll allow Tambra to kind of share what she's been experiencing as of late.
Yeah, so for a while, I've been noticing that when I wake up sometimes in the middle of the night, it'll be because I feel my hand kind of falling asleep, tingling in the thumb, index finger, middle finger most oftentimes. I know that I sleep, I'm a side sleeper, so I will be noticing that I'm kind of curling like this, which some people have said that's attributed to. Even once in a while shampooing my hair, and my right arm will start to fall asleep a little bit, and that hand again, feeling that pins and needles sensation. Or, you know, if I'm doing sideways makeup or something like that, just reaching my hand up and sometimes curling the wrist is when I'll notice that feeling start to happen. I'll have to put my arm down, you know, kind of shake it out, waiting for it to feel normal again.
Gotcha. And what condition did you think you were convincing yourself it was?
Well, carpal tunnel, and I'll take it back even to many years ago. I had this happening, and it subsided for a while and just has recently flared up again. Went to the doctor, they ran the tests, immediately, surgery, you know, tested both wrists and hands actually and said, yes, you need surgery, schedule it. You know, and there I'm going, wait, you know, answer my questions, and not even getting any time to feel like I'm getting answers. But I ran into somebody who I met in a cooking class that said, I had the same thing, you don't need surgery, probably at least start, you know, doing some stretches. I did wear a brace for a while at night, kind of to retrain myself to not be doing this, but to just keeping that wrist and hand straight. So that's helped.
Great. Okay.
But it's been flaring up again lately, so.
Absolutely. Wonderful. Okay, well, that's why we're here, right? So we actually did have the pleasure of working with her a little bit yesterday. That's how we kind of came across this conversation, and she was gracious enough to accept our invitation to come in. So what we're going to do is we're going to take a quick look at how you would evaluate something like someone thinks they have carpal tunnel syndrome. So again, she's having some pins and needles in the fingers. Mostly the 3 used to be the thumb, but it's now migrated into the 3. Okay, we're looking at radial nerve and then median nerve. So if you know your anatomy, different parts of the arm, you can get radial nerve entrapment through the triceps and the forearm. Medial nerve can come down obviously through the middle, but so we're going to look at that, different type of things. Oftentimes what we find when someone has a symptom, what we call distally or away from the body, it's because there's something near the midsection that's sort of taking the dimmer switch, shall we say, and turning it down, decreasing the energy flow and things of that nature. So what we're going to do is we're just going to have her, Tamara, sit here. She's just going to face that way. And we'll most likely use the table up and down. Okay, it's just easier. Good. And there we go. Good. Fabulous. So, some quick things. You can always just check your range of motion. So, because there's muscles that get tighter when you straighten your arm, you just want to kind of check flexibility. And if you ask if there's any jamming pain there.
No.
Okay. And when you flex this way, nothing there, right?
No.
Then you can twist, you can do ulnar and radial deviation, just asking if there's any pinching or binding there. She basically said everything's fine.
Right.
Okay? So you can also test grip strength. Grip strength is a really important thing as far as for all of us, for that matter, and you get an indication of what might be happening, right? So in this case, we're just going to go ahead and test the thumb to the pinky finger, okay? So your little, they're called opponents, digiti minimi and apolysis, if you will. So I'm going to have you keep your elbow as straight as you can and then hold these together and don't let me pull them apart. Okay? So I'm testing that, and she's going to hold nice and strong, and there's no change there, right? So we can check, just for diligence sake, each finger. You're going to hold those together. Good. And then go to middle finger. Good. Index finger. Good. So if you're having someone look at a potential carpal tunnel syndrome, I would strongly urge you to have them do some type of functional test, like a muscle EMG, which is probably what you had before, where they stuck a needle in there, they send the signal down. Are they making your fingers twitch? Are you feeling sensation in your palm? Those are kind of the tests that they do to see if there's any problems. Okay, what they don't do is actually look at functional testing. So now we're going to go back to this position, and you're going to hold that together nice and strong. Okay, and that's definitely better than yesterday, but you're still having trouble. Your thumb is stronger. Okay, you probably can't see that, but her pinky, so still the opponent's digiti minimi, so relax. So somewhere down in the palm, in the palmar fascia, there can be tender spots. And I don't know how tender is that. On a scale of 0 to 10.
Hurt,
Okay.
just
It's
a
pressure.
little tight though.
Okay.
I can tell.
Gotcha. So what we can do is we can just work in there as a quick test and just ask. Okay, and then we'll go back and test and hold them strong. Okay, so now that didn't change it. So for me as a clinician, that tells me that it's probably not in the hand. Okay, so then we can just basically, I'm going to have you just gently squeeze your wrist with your hand, and then we're going to see, hold these together, and don't let me pull them apart. Okay, and that actually weakened her. Okay, so putting too much pressure on there. So what we can do is we can just kind of spread. So just basically, instead of squeezing like this, I just want you to push down pressure like this. Okay, and I want you to hold these together, nice and strong. Okay, and that didn't strengthen it either. Okay, so at this point, I'm not really suspecting it's the wrist. Okay, so now we can do just an easy one. So just take your fingers and just wrap around your elbow. Okay, and now we'll, yep, just like that. I want you to hold these fingers together, keeping your elbow as straight as you can, your palm as much as up as you can. Okay, and then hold them together. Okay, and what do you notice?
Stronger.
Stronger. Okay, so now her grip strength is restored. Now, so if we thought it was carpal tunnel, we would have seen some type of change from a kinesiologic standpoint, that when we started affecting the wrist or somewhere in the hand, it would have started strengthening it. But we got up here to this point, okay? Now, there are several iterations we can do, and you kind of witnessed this yesterday, where I'm working my way up and trying to find the root cause. So a lot of times, if you don't know the anatomy, all the nerves that run your arm, they come out of your neck. And they come right through these muscles here. This is called your SCM, and there's muscles over here called your scalenes. You have a front, middle, and back. And what happens is, Lindsay, would you pop in the next room and grab the model? So just give it a little twist so it doesn't flop down. Okay? No, it's in your hand. There you go. Yep, there you go. Okay. So just grab the spine back over there because there's some muscles on there. So at any rate, these muscles can get really tight. Now there's a bunch of reasons why they could get tight. It could be that you had an unresolved trauma to your head, a cranial issue, which would make your cranium stick and then your muscles get tight. It could be inflamed lymph nodes because your liver's stressed out and you're not draining your lymph out of your neck, which means, thank you, means the the lymph is stuck and then the muscles around the lymph are going to get irritated. That's another reason. So you can think of some viral stress or something like that. So basically, if this is a model of me here, you can see, see if I can avoid stepping on that. If you all can see this, these muscles here are called your scalenes, okay? And this is your nerve bundle, okay? Radial, median, and ulnar nerves. So what happens is when these get tight, it starts pulling up on your first and second ribs, and it gets all aggravated. I'm doing that for dramatic effect so you can see it, but basically imagine pinching these nerves, and of course there's blood vessels going through here too, so that's going to cause the pins and needles down there because you're not getting enough blood flow to the arm, okay? So always understand that we can now just do another simple test. We can take a little bit of pressure right on those muscles, and now we can ask a different question. Is there another step up from here that is involving this hand? So take your fingers and put them together nice and strong, and don't let me pull them apart. Okay, and what did you notice?
Stronger.
Stronger, okay? So at the very least we know now it's not the hand or the wrist, it's not the elbow. We skipped the shoulder, went right to the neck. It's not there, okay? So when you start studying these things like I do every day with different participants, it's really finding like how far can you dig down to get to the root cause? Because ultimately, as a chiropractor, I could adjust Tambra and she might feel better for a little while. And I can do some muscle work on you and it will give you relief. You'll have less pins and needles, you'll have greater function, grip strength will be better. But you want to understand, like, if there's a metabolic issue or even a neuroemotional issue, because remember, there's three aspects of your being that are affected by everyday life. Structural, the muscles, bones, ligaments, tendons, and nerves and blood vessels. The biochemical, which is the organ systems like the liver, the gallbladder, and things like that, which can get congested from stresses. And then there's the neuroemotional side of our body, which the nerves, which are also tied to your brain. When your brain is where all the things are perceived from your body. And then there's the stresses from everyday life, okay? So we can do a quick exam. So we'll just have you, we'll do it, this is called reflex analysis. We'll just put two fingers on your stomach reflex point. So we're just asking, is her stomach somehow involved in her arm not working as well as she'd like it to, causing pins and needles? And I'll have you hold that together nice and strong. And what you notice is it makes no change. And then we'll just say, well, the lung's in that area. Let's see if the lung is involved, okay? And of course, if we'd be doing differential diagnosis, we'd be asking her, have you had any coughs, colds, flus, fevers, chills? Are you producing any phlegm and things like that? These are all the clinical questions that I ask, but hold these together, okay? What you notice, there's no change, okay? So let's just skip now down onto your liver reflex point, and we're gonna have you hold those together, and nice and strong, don't let me pull apart, okay? And what do you feel?
Stronger.
Okay? So without belaboring this point, I as a clinician have to decide, is that the bottom line? Is that where we're hitting pay dirt? Are we finding the actual root cause of it? Or do we need to dig further? So this just gives you an example of how you need to start challenging your clinician, your doctor, your whoever you work with, to say, how are you helping me get to the root cause of this? Because it's not enough to just think, okay, here's a symptom, we got to get rid of the symptom anymore. We have to really be focused on what is the end result and how can I resolve this, okay? And that's where we empower you with information like how can you move your body? What kind of stretches can you do, okay? What things can you do as far as your diet? What medications are you taking that might be affecting you? What supplements are you taking that would help clean things out and things of that nature? What relationships are showing stress, okay? As you know by now, we talk every week in the Wisdom Wellness Minutes about the different sides of the body. So you got your masculine side, you got your feminine side. So if I'm walking around with a bum shoulder, maybe I'm having trouble getting out of the way of someone in my life, maybe a female of some sort. If it's my right knee, maybe there's a buddy of mine or my dad or somebody like that I'm uncertain about how to approach that relationship. So there's always some form of connection there. Because remember, your brain, like your body is your subconscious brain. So when you have a stress that shows up there, and you haven't had a trauma, understand that it's really something coming from the inside showing it on the outside. It's like your check engine light on your dashboard. It's really what it is. So, okay. Let's see. What else can we do with this? So basically, okay, so let's just say, if she's having pins and needles in her fingers, right? We know from a neuroemotional standpoint, inability to let go or inability to grasp something. That's usually what the hand is. The wrist could be overworked, underappreciated, underrecognized from a general standpoint. Elbows, inability to oppose. Shoulders, inability to get out of the way of or feel like a failure, depending on which brain lobe it's in. Neck is inability to understand, criticism, stubbornness, and all that kind of stuff. So you just start working your way up. And when you find that what you think is the root cause, like, the neck, let's just say that, okay, so maybe she's feeling criticized, someone's stubborn in her life, or she's having trouble understanding someone. That's where, as a clinician, we just dig down and we help her understand, like, connect the dots. Because then when Tambra is then empowered to understand what's going on in her life, then she can address that. Because if you leave that conflict unresolved, guess what happens? It just lingers. Mm-hmm. And then you spend 3 weeks, in purgatory with something like a condition, and you're all worried about, do I need surgery and things like that? Oh God, good golly, here it comes back again. Mm-hmm. All I want for Christmas is my fingers feeling normal, right? We want to appreciate that, people come here to be empowered. They don't come here to just say, just fix me. Mm-hmm. They want, it's the old, it's probably a biblical thing, but give a woman a fish today, what does she do?
Fishes and loaves.
Yeah, exactly. And if I teach you to fish, she can fish for the rest of her life, right? Mm-hmm. So knowing about your body and understanding the different intricacies, that's what's most important, okay? Mm-hmm. So generally speaking, for someone with this type of condition, we can teach them how to work on different muscles, like this is the pronator teres, which we worked on a little bit before. So we can help her understand how to stretch that. We can help her lengthen the muscles in her neck. So basically a general stretch for you would be to reach as far as you can that way and then tipping your head this way, okay? And what you'll feel typically is a strain or a stretch in the neck. Now, how you turn your head, like if you look up at the ceiling, you might, there you go, a little twinge there. Mm-hmm. You might feel it more in the front or in the middle, right? And you feel it in the back. Back here?
Right here.
Okay, so the upper trap, all right? So if she turns down this way, then she drops this way, that might get the levator scapulae, so you might feel it more in the shoulder as well. It just depends, okay?
Mm-hmm. And why is it important to hold the hand out?
Because you're stretching the dura, okay?
There's something in there?
Yep, so over every one of your nerves, so when your nerves come out of your spinal cord, I don't know if I can illustrate that at all. So you really can't see in this model on the camera, so I'll just kind of explain to you, Tambra. But within this bony case here is your spinal cord. And these nerves that come out, they're connected to your spinal cord, which connect to your brain. They have a cover over called the dura. Okay. And sometimes we can get what are called dural sleeve adhesions. Mm-hmm. So basically over every one of your nerves, at some point, there is the dura, which is a really hard fibrous material. Mm-hmm. It's a protective covering, right? So it helps it avoid lacerations and stuff like that. So when you stretch like that, you're stretching the dura. And you can feel it just up in here. Sometimes you can feel it in the elbow, sometimes you can feel it in the wrist. Just depends on how far down that nerve sheath you have the sleeve adhesion. Mm-hmm. Okay, so the dura, think of it as sort of like fascia. If your shirt slides up and down just fine, that's normal functioning fascia. If I stick this here and I try to pull up and down, it's not sliding very well. That's a dural sleeve adhesion or a fascial adhesion. So you want things to slide up and down nicely. Okay, and if your nerves, some people do what's called nerve flossing. If your nerves don't floss very well, like slide in and out of that dural sleeve, then you're going to get tension, okay? And you'll feel it more in certain positions, right? So if I tip like this, I can feel it here, whereas you felt it back there. And if I start turning, I can feel it in the same spot. And mine pretty much stays right in the same spot. I get a little bit in the back now, and then I go down like that. So that's how I recommend people do stretches.
Stretch and hold.
Yep, well, it's more dynamic than that, but you lean, or you reach as far as you can to the side, and then you turn to that arm, and you tip your head back. Okay? And you may not feel it there. So you just start looking back and around, and then wherever you feel it.
When I get to that point where it talks to me.
Yep, take a nice deep breath in, and out. Okay? So I can feel it all the way down to my fingers. So clearly I need to do more dural flossing. Okay?
Okay.
But hey, we all have opportunities for improvement.
Right.
Room for growth. Okay. We can also see from a more of a central standpoint, we can see how your neck flexors are wired. Okay. And then we'll do a couple fixes. Okay. So tip your chin down here, and I want you to hold there. So I'm trying to isolate her neck flexors. So I'm just going to have you hold there, and I want you to resist whatever I'm pushing. Okay. Okay. Now, if I push a little bit, you can hear my voice. I'm not straining very hard, but she's clearly not able to hold that. Now, sometimes it puts people in pain. Other times it just doesn't work. Okay. So what we can do is we can do our fun little experiment. We're going to go 2 fingers back on your liver reflex point, and we're just going to see if that changes anything. Let's just see if your neck is tied into your arm. So hold there. Don't let me push. Okay. And you see, I was putting probably about 50 pounds of pressure on there, and that was basically effortless for you, correct? Was it hurting when I was straining your neck? Like when?
No,
Okay.
it's
just like it just wasn't working. Okay, but now it works. Okay. So clearly, and we have already had a conversation about this yesterday about helping cleanse some of the stress out of there. Okay.
Right. And knowing that for me, it's my liver.
Right. Absolutely. Yep. So if you have chronic pain in your body, suspect the liver because that's one of the most common areas. Okay. But there are also different connections to the body, right? Shoulders, necks. We talked about that. So you can start piecing together the puzzle, and it becomes a whole picture instead of just like, if you ever try to put a 5,000 piece of puzzle together, and you're like, oh, just do the borders, okay? So we start painting that picture, and we start bringing it together, and you get there's this, let's just say it's a bunch of animals, right? There's the fluffy dog over here, he's got yellow fur, and I find all the yellow pieces and stuff like that. So we basically put it together, structural, biochemical, and neurological, neuroemotional. And that's how we have found people are the most empowered and the most helped, because then you're not just walking out here with a physical treatment, you're walking out here with knowledge and understanding of what is going on in your life, and then you can choose to affect and change that if you desire.
And again, going back to that core problem and healing that instead of just putting a Band-Aid on the symptoms.
Right.
Yes.
The definition of insanity is doing the same thing over and over and expecting a different result. As you well know, we don't do that around here. But at the same time, there are certain people that say, just come back in 3 times a week for 4 weeks and we'll adjust you and we'll just keep educating your spine back together. And eventually we'll just then have to maintain that. So come in once a month or once every 2 weeks or whatever it is. Your brain's way smarter than that, in my opinion. So we need to teach your brain how to hold itself. That's why we do muscle work. Okay. So let's just do a quick example. Let's just see how this is holding from yesterday. Okay. So, all right. How did we do that? We're testing the pronator tears. Okay. So hold your arm here, keeping your elbow straight. Don't let me turn. And good. And then hold it again. Okay. Now yesterday, what happened was that thing flipped open. Okay. So the work we did on the pronator teres is holding. Okay. So we'll just see if we can find a way to strengthen your neck so that when you walk out of here, that hand stays strong, and as you work to detoxify or heal the liver, or whatever we're working on, okay? Okay, so let's just tip your ear to your shoulder, and I want you to hold right there. Don't let me push. Good. And just for the sake of example, would you put your feet on here? You comfortable with that? Okay, there we go. So just tip your ear to your shoulder. Yep, that way, and hold nice and strong. Don't let me push. Good, and don't let me push again. Fabulous. So now we're going to start isolating a little bit. That's kind of the upper trap. I just want you to tip your head back a little, and then hold there and don't let me push. And don't let me push again. Good. So now we're going to go back down, and we're not going to go all the way this way. We're just going to tip sort of at an angle like that. And you're going to, instead of pushing down this way, you're just going to resist my force. Okay? And then hold that again. Okay, so the scalenes are doing pretty good. Okay? So you're going to push, just resist my force. There, there, there. Okay, so now we're going to go back down here, and we know this here is just not holding. Okay, so we need to strengthen that. Okay, but we also want to make sure that there's nothing we can do on the backside, because most of us are spending our time working like down like this. The average person is working on over a desk or something like this, so everything's pulling down. So before I go and strengthen her neck flexors, which are probably most likely overactive anyway, let's just see if we can affect anything. So I'm just going to basically say, all right, so I'm just going to tap your thoracic spine. It's just basically saying, is there anything in the back here that's going to help her neck? So we're going to tip your head down there, and you're going to hold there and don't let me push. Okay, so in this case, it's saying no. Basically, nothing's helping. We can say, if we activate the upper trap, will that help her neck flexors? Because those balance each other out. You're going to hold strong, and that's not happening. Okay, so we're not going to belabor this point and put her through a bunch of tests where she's feeling like she's at the Roxbury and bobbing up and down. So what we can do is we can activate her SCM, okay? Sternocleidomastoid. There's two heads on the neck here. This is your mastoid up here. This is your sternum here in the middle and your clavicle here. So we're going to just do this. We're going to tip down this way. You're going to take a breath in, and then tip straight back toward the ceiling as you exhale. Okay? And if you're doing this right, it should not feel like she's being choked. It should feel like there's just pressure. Exhale. Okay? Good. So we're retraining the muscle. Deep breath in. Exhale. Okay? Good. So now we're going to bring your chin down and hold it nice and strong and don't let me push. Okay? And as you can see, that was pretty effortless, yes? Mm-hmm. Okay. Any pain on the rebound? Mm-mm. Okay. I typically do a rebound just to make sure there's no other weak ligaments or tendons or things like that to make sure. Okay? Let's just test your left side. Tip your chin down, and then just hold there and don't let me push. Okay, that side's actually working just fine. Okay? All right. Now let's go back and see what that did, if anything, for the hand. So hold those together, nice and strong. Don't let me pull them apart. Okay? Feels pretty good. Hold strong. Okay, so there's still some improvement there left to be done. So I'm just going to activate that pronator teres again, which is always a fun spot. You're going to hold there. Okay, so that wasn't it. So let's just ask down here. There's usually pretty tender in here. Okay, I'll have you straighten that out again. That gave a pretty good result. Okay, so that right there, I don't know, she's pretty stoic. Most people would be like, ah.
It's always tight there.
Okay.
So,
yeah. Okay.
We know this for
right. Okay. So this is your middle scalene. Okay. So what we're going to do is we're just going to tip this way, and you feel it pulling through there, or do you feel it back here still? Because this is like tighter than a banjo string. Okay. All right. So just gently push your ear to your right shoulder. Okay. And then drop it down to your left shoulder. Okay. And then exhale as you do that. Exhale and push. And then drop it down. Here you go. And deep breath. Here you go. And then relax. Okay? Good. Hopefully that wasn't too painful.
No.
Okay? Sometimes it doesn't tickle, let's be honest. But we're looking for the end result. Okay? So elbow straight, palm up, fingers as tight as you can go, nice and strong.
That's good.
That feels good. Mm-hmm. Okay? That's good engagement, good strength. So I'm curious, I didn't ask you between yesterday and today, last night, did you wake up at all? Did you have any pins and needles? I mean, we don't expect Rome to be fixed in a day, but I'm curious.
No, I didn't.
Okay.
I didn't wake up last night at all with that, and I didn't feel it this morning.
Fabulous.
Either.
Okay. So steps in the right direction,
Mm-hmm.
right? We'd like to build Rome in a day. We'd like for this to be, I'm glad to hear that. No one thing causes any one thing, no one fixes any one thing. So working on the elbow yesterday gave her a lot of good relief. We've done more work on the neck today. This is just an example of how we want to empower you to challenge the people you're working with. Remember, no matter what initials they have behind their name, they work for you. Okay, so my job is to serve her better than anybody else possible. Okay, and that's how I'm obsessed. I'm every day. So, like, this is my uniform, right? I used to play athletics. I would joke about this. Like, I suit up and come in, and I'm like, this is game time. Like, how can I get her as big a win as possible? So that's what we do here, and I know people feel that because they refer people here, and that's the whole point. The point is people walk out of here feeling better, right? We joke that it's the limp in, leap out clinic, okay? Okay, people come here dragging legs behind them and they walk out, hey, I feel pretty good. Mm-hmm. So, but ultimately I think, and I know you would attest to this, but, when you leave here, you have a better understanding of your body and yourself. Mm-hmm. And it's all about knowing yourself better and being more empowered each time.
Absolutely. Right? Yeah, and I can say that because I've been coming here for years,
right.
and ever since you opened, and
yep.
my kids as well. So
right.
we have lots of great stories and testimonials that I know really are
absolutely
really, really workable.
Yep. And it's life stuff, right? That's because if you don't walk out of here with the information about how to help yourself, then it's just basically you're going to be you're going to be dependent on us. And that's never the point. It's all about, give them what they need as far as skills. It just works itself out, right?
Absolutely.
Our job is to, when you come with a proverbial broken wing, we release you back into the wild, right? And if you get dinged up again, then you come back in.
And that's what I do.
Exactly. This is how it works.
This start happening,
Right.
I know where I'm going.
Yeah, exactly. Right. So, okay. Anything else you want to share? Any questions based on like anything that we didn't talk about yesterday? You didn't have an opportunity to ask questions about?
So, when we're talking today, what should I do on my own now about the neck thing? Because yes, I know, working at a desk job, doing a lot of this. We live like this anyway.
Absolutely.
So it's a lot of that mouse computer stuff. What would be good for me to do?
Well, if you don't already have one of these are really great for mice.
Okay.
I drive my team members crazy by having these, but it's called a trackball. You can get them with ball in the middle. You can get them with the thumb, but basically it removes the need for you to move your arm around, which will decrease the tension in your shoulder. So as an engineer, when I used to do design work, I would sit there for the first couple days I worked, and I was like, this is crazy because my arm was so sore doing that mousing.
Okay.
I just got this so I could just rest my arm and just move my thumb around and tap. Okay? These things are fabulous. You could probably get it on, Amazon for $30. Well worth it. It'll save you a lot of pain and suffering. For those who don't have that luxury or don't have it just yet, I would set an alarm, a reminder, shall we say, not alarm, but a reminder every hour or every half hour to stand up. Okay? Now, because we're so focused on the front, there's a really great thing called it's called foundation training. Okay? There's a movement called the founder. Okay? And I can teach it to you so you can do it because you do spend quite a bit of time seated, right? Okay. So what you want to do is, because when we sit down, we shorten all of our flexors. We need to strengthen our extensors. Okay? So you can mimic it with me. So just stand up here for me. And so the movement is basically, if you stand facing this way, hopefully you can see this angle. What I do is I lock my knees and then push your hips back a little bit, and then bend your knees. Okay, so you got a nice tension in your quads, nice tension in your glutes, and then you tighten up your core. Okay, and then you reach for the ceiling like this. Okay, and you literally want to feel like you are reaching this way as you push your tailbone that way. Okay. Now the guy who developed foundation training, he's a chiropractor. His mom's a yoga instructor, and he blended a bunch of stuff, stretching and yoga and stuff together. But it should literally feel like you're trying to pull your body apart, okay? And you're going to activate everything from your neck extensors to your mid-back to the glutes to the hamstrings and everything in between, okay? And if you do that for literally 30 seconds,
and just hold it.
30 seconds, even once an hour, you're going to be amazed at how much better you're going to feel, okay?
Okay.
Now he has classes and stuff like that. You can get online videos and stuff like that. But if you just learn how to do that one movement and you do that 30 seconds every half hour, every hour, I'm telling you, your body's gonna be so much stronger because remember, everything gets shut off because we're sitting like this and thinking like this and we're mousing like this. We never turn on these extensors, right? So when people ask about what exercises you do, I recommend all extension exercises because we're doing so much focus this way anyway. So pull up, pull back, and pull down are the three movements that I recommend. Okay, laying on the floor and doing the Superman. If you've never seen the Superman, you basically lay on the floor and you act like you're flying through the air. Okay. If you don't see that, it's like this. So just lay on the floor with your chest on the floor, raise your arms up and raise your legs off the floor and hold that as long as you can. It'll start burning and cramping and stuff like that, but you'll get better at it each time. But anything you can do to turn on the back muscles, the extensors, is going to help you a lot. Okay? Gently doing your stretch where you lean to the side and then you track around and down, back, and everywhere you feel a tight spot, just pause, take a couple breaths, and then keep going. Okay?
Sure.
Do that a couple times. If it doesn't go away after 2-3 days of that, then say, okay, all right, what am I missing? Just basically ask yourself the question, okay? But it's really not that complex. Once you know the questions to ask and you know where to look and know what doors to knock on and how to challenge different tissues, it's not very complex.
Okay.
Okay. But really, certain things, some people don't like to do coffee colonics, but it's certainly for livers. It's the fastest thing you could ever do to clean out your liver. I mean, they used to do them in Egyptian times. They had we have a handout that literally talks about the guardian of the anus. It's kind of crazy. But in Egyptian times, they had people that literally walked around. They were the guardian of the pharaoh's, backside, shall we say. But they used to do coffee enemas all the time. Different from our culture, we drink it all the time, right? It works a little differently. But if you want a fast way to detoxify your liver, there is nothing faster. There's no supplement on the shelf out here or anywhere else in the country that can detox you faster than that. But anyway, that's one thing you can do. Herbs, homeopathics, and nutritionals is what we use here. We don't do coffee enemas and coffee colonics in the clinic, but people do them all the time. I mean,
but you do have the things that you.
yeah,
take
we can
home to
provide those resources for people and guides and help them understand, because ultimately, when you have a bunch of medications in your body that you're trying to detox out, it's really tough to get them out, especially if you're trying to wean yourself off of them. So you have to be mindful of what medications you're taking, things like that. But there's a ton of stuff. We can package the toxins with nutritionals. We can support the immune system in the liver with herbs and things like that. Do drainage remedies like liver drainage or liver gallbladder meridian opener, things like that. There's a bunch of stuff you can do. But ultimately, having the power to know, or the understanding to know what relationship it is, what toxin it is, what stressor it is, right? You just sit and then you're set free.
This I know.
There you go.
Right, I have some experience at this with the
Old
yes,
pro,
yes.
right? She knows. She's been through it. Okay. Anything else you'd like to add? Sweet.
That's good.
Okay. We're so grateful for you to be here this evening.
Thank you.
Hopefully we provided you some benefit. In addition, I know that your shoulder is going to be better now. But yeah, so let us know what conditions you're challenged by. Of course, we'll do things like pins and needles and stuff like that, because Facebook does not allow us to reach as many people as we'd like to when we talk about conditions. It's just part of their censorship system. So what we want to do is understand what you're dealing with, and then we'll phrase it in a way that will let people know, and then we'll present that information. But if you're ever interested in coming in here for Wednesday Wellness Minutes and to be a specimen, shall we say, we call her Wonder Woman, so we want her to feel like she's Wonder Woman when she walks out of here. But just let us know if we can help and if you want to be a part of it, and we'll look forward to seeing you. Okay, so Merry Christmas, everybody. We will not be here next week because it is Christmas. Okay, so the 25th, we're off 25th through the 28th, and we'll be back the following Monday. Then we'll be open Monday and New Year's Eve, and then we're off New Year's Day. We'll be back the rest of the week. Okay, so great. Happy holidays to everybody. Thank you, Tambra, once again.
Happy holidays.
All right, take good care, guys. We'll see you next week, or in 2 weeks. See you in 2 weeks.